Arlington has set out on an ambitious effort to help those with mental illnesses who have entered the criminal justice system. The Crisis Intervention Team, or CIT, has developed a multi-step process that looks at each individual case along the entire criminal justice system. This ensures that each person receives the care and attention they need. So how does this program work? And more importantly, has it been effective?
No one wants to go to jail?
Jail diversion is trying to identify those individuals that certainly are mentally ill or dually diagnosed that are in the system primarily what we see for reasons related to their mental illness. There are programs out there that we could link them to. They could get those services that they would require to be able to manage those symptoms and be able to make it just like you or I in the community.
The criminal justice cycle really involves a lot of things. There's time in jail, there's time underneath the supervision of probation and parole. And there's also times when perhaps clients are not meeting regularly with the probation officer, but they're still required by the court to meet certain criteria. And so what we try and do is we try and help them through that, help them get out of the cycle and into services.
The jail is bursting at the seams with individuals with mental illness. Jail diversion, in theory, will save money because you are diverting them to services that are already in existence in the community. So these services are not made up. They're here already. They've been available to the community all along.
In order to identify how those with mental illness interact within the criminal justice system, the forensic team uses the sequential intercept model and diverts their clients into the necessary services.
This is a model that basically speaks to the various intercepts or points that any individual, anybody would go through in the criminal justice system.
The sequential intercept model outlines 5 different points along the, I guess you could say, criminal justice timeline, where mental health therapists and or law enforcement therapists can intercede and try and divert the client into services and try and break the cycle of criminal justice involvement. On this first intercept, the forensic jail diversion team has developed a crisis intervention team training in hopes that law enforcement can be better prepared to respond to clients with mental illness and be able to divert them into treatment as appropriate.
The CIT program originally is basically designed to give officers a basic understanding of mental illness, more than we would have in the academy or anything or any other training that we go through. From that, we then give the officers de-escalation techniques and active listening skills that have been shown and proven to be able to de-escalate a person that is in a crisis state as a result of a mental illness. The current percentage of Arlington County officers in the operations section that are CIT certified is at 25%. Our current goal at this point is to have 40% of operations section CIT certified.
Our second intercept is where we work very closely with the magistrate's office. So whenever there's someone that is brought in by a police officer with sort of what we would call a low-level misdemeanor crimes.
The third intercept is the court-level intercept. As clients might be found incompetent to stand trial, we have staff on the forensic team that's able to link up with clients and begin working and start planning for the eventual discharge and entry into services.
The fourth intercept is sort of that reentry phase. It's really focused on addressing what needs they might have. So they're still certainly going to have the same needs related to, where are you going to get your medication, where are you going to get your therapy from, but they're also going to have needs related to what is it like to come back to a community when you've been in jail.
And the fifth intercept is the community. So at this point the client has perhaps gone through all of the court steps and criminal justice steps, but now they're perhaps under probation supervision, so they're still under court supervision. And we'll work with the client at that point to help them remain in services and help them avoid going back to jail. Working with the probation officers in Arlington County is key at that intercept.
The county's new Crisis Intervention Center has become the entry point for those who are diverted into services.
So we're here at 1810 North Edison Street. This is a building that encompasses all of the client service entry programs. We are basically the entry point to all services related to Arlington County for adults.
What we've done with this building is we have co-located all of our client service entry programs. The idea being that all the front door services are now located in the same building, and so there's one place for clients to go who are interested in entering services in Arlington County.
It's really linking someone who has needs to the resources available. We assist and facilitate and make things better and help you recover so you can lead a good life as a citizen in Arlington County.
Certainly we have some challenges, but there are certainly a number of success stories where clients come out of jail, go into treatment, and don't have to go back to jail, and that's what we consider a success.
If you'd like to learn more about the Jail Diversion Program, or CIT, visit the Arlington Human Services website at arlingtonva.us and search Human Services. That's all for today's episode. For AVN, I'm Mayo Best. Join us next time on Up Close.